My fear when I went to work was bringing it home to my family. So that's kind of where I was every day, like fear at work, catching it and not knowing that I caught it, and then coming home and giving it to my family. Yeah, that was my main fear when this first started.
Mm-hmm. And then to go off of that, being his wife, and then we have two kids. Our kids are 6 and 8 years old, but at the time they were 4 and 7, I believe, or 4 and 6, something like that. And just going off what Harvey said, I always feared for his safety when he would go to work. Because this was such an unknown disease, all we knew was this is serious, this is bad, it's a pandemic, what can happen to us? He works in a hospital, we're at home, what's gonna happen? And then just, the mental part of it, aside from the physical health part of it, we were always at home. We shut ourselves away from family and friends, and we just kind of kept to ourselves. And so I think it just affected everything, everyday life, safety, your mental health, everything.
Yeah, I believe in the science, immunization. So, it was a no-brainer for us.
Yeah.
And actually our son got COVID.
Yeah.
And he was vaccinated.
He caught it from class.
But I think being that he was vaccinated, his symptoms and his recovery was shorter.
Yeah. Symptoms were not as severe. It kept him out of the hospital, and we do very much so believe that. Mm-hmm. We started the conversation saying, Daddy's a nurse, and there's a lot of sick people right now. So the reason why we're staying home and you're not in school is because there's something really bad going on out there. And your daddy's helping those people at the hospital. But for us to be able to help everybody, we have to stay home. So finally, as time went on and the vaccine was released for their age group, we kind of, I know that I talked to them and I premised it that way, that I said, remember how we have coronavirus going on, and now the doctors and scientists came out with a medicine that can help protect all of us. So your daddy and I got ours, your grandparents got theirs. And now to keep you safe at school, especially because you go every day, we're going to get you that medicine. And, it's just another layer to keep you guys safe. As a parent, you need to tell yourself that disinformation is deadly. You cannot speak to your kids until you yourself have accurate information. You can't be going to all these unreliable sources on the internet or just talking to random people. You need to go to reliable sources, go on the CDC website, talk to your doctor, your family doctor, somebody who is credible that will give you accurate information. Because I believe just watching how it's been these last 2 years that's how it starts, is inaccurate information, then not believing in the science, not believing in the protection, and then therefore not even considering it for your child. But when you're going to talk to your child, you can even preface it by saying, how you get your flu shot every year, we go and get a flu shot. That's kind of what I said too. We're going to get a shot to help protect you against the coronavirus, that yucky, virus that's going on out there. And this is going to keep you safe. Just kind of keep it simple. And if most kids are going to be like my kids and be like, is it going to hurt? And just be honest, it's going to be a poke, but then you're going to be so safe afterwards. And, you're going to have just another layer of protection. I think if this is okay, another piece of advice I would give parents is to find a place for the child to get their vaccine, a place that they're comfortable going, that they know is kid friendly. I actually called ahead to a few places and asked, are your technicians or your pharmacists really kid friendly? I think that is very important for parents to also keep in mind, so that the child will have a positive, mostly positive experience when they get their vaccine.